Your teenage child has been diagnosed and struggling with functional neurological disorder, short for FND, that includes non-epileptic seizures, PNES, or NES. Now, I don't know how long your teen has been struggling with this condition, even without getting a formal diagnosis. My question is, what is your goal and what is your teen's goal when it comes to FND? Specifically speaking, are you trying to get rid of FND or are you trying to live with it? You might think it's easy, but it's not. And let me walk you through what that means. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy. So today's video is really about why goal setting is so important and how to go about it. In my online program, Teen FND Academy, one of the very first things that I ask everyone to do is to set the goal. And when I say set the goal, you might be surprised that there are so many people who say so many different things when it comes to setting a goal. Of course, it has something to do with FND. But what is FND? Once again, it is an umbrella term to describe this neural network circuitry communication problem. So basically, it's a network communication problem that is cross-wired between a brain and a body, even though your child's brain and body are functionally not working, but structurally and physically, quote unquote, okay. It is a real diagnosis. Your child's not making things up. So if the doctor is saying it's all in your head, I need to know who that is because that is so invalidating and pretty gaslighting, medically speaking. Anywho, FND is a biopsychosocial phenomenon and it's not just one thing that is the cause of the problem. So once again, if your child's doctor is saying, oh yeah, it's all psychological, it's coming from stress or anxiety, no, it's not. Yes, there might be a psychological component going on, but stress or trauma are not even necessary for the diagnosis of FND. With that, teen FND is different from adult FND. Statistically speaking, over 90% of adults who've got FND has something to do with childhood trauma or adversity or something like that. Teen FND, that's like the less than half of the case. So if you, oh my gosh, my heart goes out to you. If you have been wondering, driving yourself crazy, what did I miss about my child's this trauma that I don't know of? Calm down, because that may not have anything to do with your child's FND. There are so many misinformation and disinformation out there, and you really need to know what it is accurately. All right. So going back to this goal setting. So why goal setting is really important? Well, depending on what the goal is, it really changes how to go about it, right? Most of the time, the teens that I work with and then the parents I work with, they are 100% on board with, yes, we are ready to get rid of FND at all costs. Yes, we are ready. We are committed, we're ready, and we're ready to go because we have had this for so long and we are so sick and tired of it. Great, I can help you with that. And then there's a few that I ended up not working who's in this band camp of, well, FND is something that I'm going to be having because I was told by a doctor it's a permanent, then I have to live with it and this is a disability and I'm going to have to use all kinds of assisted devices like wheelchair, crutches, sling, or service dog for my FND because there's nothing I can do about it anymore, meaning for the rest of my life. So I'm going to be living like this, like I have disability forever. While there's nothing wrong with it, that mentality and the mindset and then belief system has very different implications compared to, no, I'm going to go back to my life. I am so ready to get rid of this FND so I can continue to live my life and thrive, getting back to normalcy and stability and just all kinds of stuff. So who's watching this video? Which one are you? And I am not here to judge one is better than the other or one is good versus the other is bad, because who am I to say? Your life, your choice. So you get to pick and choose, right? So there's nothing wrong with either choices. But the reality is teens in general have much higher level of completely resolving FND, like over 90%, as long as they take the right approach. I would say air quote, the right approach compared to adults who's been struggling with FND. I'm not saying adults with FND are like, doom and gloom and then there's no chance. No, absolutely they can get better. However, as soon as they have this identity mindset of this is who I am, the FND is something I'm going to be living with for the rest of my life, then there is absolutely no chance of curing or resolving from FND completely. So that's really what I'm saying. And teens, even though they feel desperate and then feeling kind of hopeless because they have been there, done that, they're not getting better, all kinds of wrong approaches or whatever, even if they're losing hope, their chance of resolving completely is really high, as long as I said they take the right approach. And that right approach starts with the right kind of mindset and then the goal settings. So what can you do? So if the goal between you and your child is to get rid of FND, then welcome to my club. That's the kind of people that I'm talking about. Then I would say check my 3Ps video. 3Ps stand for predisposing factor, precipitating factors, and perpetuating factors. So just to kind of give you a heads up, predisposing factor is something that has been cooking in the oven for a long time. This could be your child's recurring injuries, growing up, family dynamics, school, and personality, coping strategies, belief system, and things like that. And then the precipitating factors usually are triggers, and that could be like bang, like one big thing, whether it's a concussion or this viral infection or this one thing that happened that sort of spiraled into developing FND, or it could be micro things that happen over time, and then it just took one more thing, kind of break the camel's back, so to speak, to spiral into FND. But whatever it is, it's a triggers usually that started the FND symptoms. And then the third P, perpetuating factors, are usually what I would call it, what's keeping the fire of FND alive. So these are not necessarily the reasons why your child started having FND symptoms to begin with. However, these are the reasons why your child continues to have FND symptoms, such as constantly being hypervigilant and living out of fear and worry about whether their symptoms are gonna flare up. That includes childs themselves and yourself as well. There's a lot of these reinforcement factors, which I would call it perpetuating factors, right? So you have to know what these things are, because just addressing one thing isn't going to solve everything, right? Usually in my program, I always start from this perpetuating factors. What is keeping this fire of FND alive usually has something to do with anything that flares up the fight or flight system. So that is where I start with. And then we move on to the triggers, not necessarily to avoid or prevent it, but to learn what it is so then they can approach it, right? That is the best way to overcome the triggers, so they don't constantly live in this fear of avoidance and prevention. Then only then we go into these predisposing factors. So what was kind of cooking in the oven in the first place. And this is more like the big why this is happening in the first place. But you really need to know what your ultimate goal is and what those 3P factors are. Once again, if you're not able to find them on your own, nobody's asking you to continue to do this DIY program. This is your child's health we're talking about, and in your life as well. And this is why you need to have a guidance from an FND specialist, especially who knows what they're doing with teen FND specifically. Back to the next one. What can you do then? What are the obvious things that you can do? I would start with attention. How much attention are you putting? I'm assuming by the time that you're watching this video, you might be binge watching all of my other videos, which is great because you definitely want to learn more about what you can do to get better or how you can help your child who's struggling with FND. That's totally great. I also want to say, how much are you drawing attention to your child when it comes to these FND symptoms? AKA, are you asking a lot of questions related to FND? If so, stop asking. And are you considering or having your child use assistive devices, wheelchair, crutches, sling, basically anything that includes a service dog for FND? Once again, anything that has to do with FND when it comes to assistive devices, those are very, very powerful messages that you're basically giving to yourself and your child. Might as well live with this for the rest of your life, even though you're thinking, oh no, this is just a temporary thing. But think about it. If your goal is to get rid of FND, then assistive devices are not going to be helpful in a long run. So why bother using these things unless it is just for very, very occasional temporary things? And I have something very strong feeling about people wanting to get a service dog just for FND. For other things, okay, epilepsy, diabetes, POTS sometimes, although kind of questionable, emotional assisted dogs, there's nothing wrong with that. I love animals. I don't know if you can see my Winston back there, but I love animals. I mean, Winston is my weighted stuffed animal. But anyway, unlike wheelchair, you can kind of get rid of it or donate or just give it to somebody else. You can't just get rid of a service dog that is specifically for FND. And so I have very much high level of concerns when it comes to families opting for this service dog, because you can't just get rid of it. And you can't just use a service dog every once in a while. It doesn't work like that, right? So once again, if you choose to live with FND for the rest of your child's life, then go ahead, and absolutely there's nothing wrong with it. However, if the goal again is to get rid of FND, then it's kind of going against the grain. And related to that, anything that would basically hinder the resolution of FND, so cutting back the hours of school, for example, while it's totally understandable and then pretty valid concern, again, you cannot continue to get rid of or make your child avoid these potential triggers for the rest of their lives. They're not learning any skills to approach and overcome those potential triggers or stress in their lives, basically. So anything that is potentially perpetuating the symptoms, I would start from there. Start eliminating those factors one by one, gradually. Most of the time, you probably have to talk to your child about, hey, this is what we're going to be doing things differently, because otherwise they might get confused, oh, what are you doing, suddenly, kind of thing, right? So just have a heads up conversation. And then related to that, continue to watch my videos on YouTube or anywhere else you're watching. Exactly know what FND is. Because the solution, if you're doing a DIY project, I can almost tell you probably isn't working. So there is that. And that really starts with accepting the diagnosis. So if you are having this doubt and questions and concerns about this diagnosis, feel free to get the second opinion or ask the doctors, hey, how did you get this conclusion? Tell me, because I don't know anything about this FND. So how did you get to this diagnosis as opposed to epilepsy or something else, right? That is so much better and more productive than just refusing the diagnosis and then thinking that there's gotta be something else out there. And as I mentioned, you cannot do a DIY project when it comes to FND resolution, because you are not trained to do this on your own. And rightfully so, none of the parents are. That's why specialists exist. So make sure to find a specialist. If you're saying, well, I can't find anyone, well, have you seen the list of providers throughout the country down in the description box below? It's there for free, and you don't even need to opt in for anything. You can just look for provider information, and you don't have to work with me in particular. There are others that are wonderful out there who are legitimately trained and know what they're doing. But you have to work with FND specialists. Now, my approach is not like a hospital-based program where you don't need to go anywhere. So if that is something you're interested in, happy to talk to you. But also, I do have a Facebook group where we can have this conversation privately, along with like-minded parents like you. So check those out. They're all down in the description box below. Hopefully this was helpful. Again, you might be thinking, goal setting, yeah, well, my goal is to get rid of FND. Well, there's a little bit more to it than that, and is your action completely aligning with that resolution of FND without having a guidance is really the question. Thank you so much for watching this video, and I will see you in the next video.